Today we will discuss inhalation injuries. But really quickly, are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. An inhalation injury occurs when the airways and lungs are damaged due to breathing in smoke, chemicals, or hot air. This can happen during fires, chemical spills, or accidents involving toxic substances. Signs you might have an inhalation injury. 1. Coughing, persistent cough, especially if it produces black or gray sputum. 2. Shortness of breath, difficulty breathing or feeling like you can't get enough air. 3. Wheezing, a whistling sound when you breathe. 4. Sore throat, pain or irritation in your throat, especially after being exposed to smoke. 5. Chest pain, discomfort or pain in your chest, especially when breathing. 6. Nasal irritation, a burning sensation or irritation in your nose and sinuses. 7. Confusion or dizziness, feeling lightheaded or disoriented can also indicate serious problems. If you suspect you have an inhalation injury, it's important to seek medical attention promptly. If someone has an inhalation injury, here's what to do. 1. Get to fresh air. Move the person away from smoke or chemicals to a place with clean air. 2. Call for help. Dial emergency services or get someone to help right away. 3. Stay calm. Encourage the person to stay calm and breathe slowly. 4. Loosen tight clothing. If possible, loosen any tight clothes around their neck or chest. 5. Monitor breathing. Keep an eye on their breathing. If they struggle to breathe, be ready to give information to medical help when they arrive. 6. Do not give food or drink. Avoid giving them anything to eat or drink until a medical professional evaluates them. 7. Stay with them. Keep the person calm and stay with them until help arrives. In the hospital, here's what doctors and nurses typically do for someone with an inhalation injury. 1. Oxygen therapy. They might give oxygen to help the person breathe better. 2. Assess the injury. Doctors will check how serious the injury is, often using tools like a stethoscope to listen to the lungs. 3. Medications. They may give medicines to reduce swelling in the airways and help with breathing. 4. Fluids. If the person is dehydrated, they might get fluids through an IV. 5. Breathing treatments. They might use a nebulizer, which is a machine that delivers medicine directly to the lungs. 6. Monitoring. The medical team will keep a close watch on vital signs like heart rate and oxygen levels. 7. Supportive care. They'll provide care to help the person feel more comfortable and manage pain. In serious cases, they may consider more advanced treatments, like placing a breathing tube to help with ventilation. Here are some commonly used medications for treating inhalation injuries. 1. Oxygen, administered to improve oxygen levels in the blood. 2. Bronchodilators. Medications like albuterol help open the airways, making it easier to breathe. 3. Corticosteroids. Drugs such as methylprednisolone reduce inflammation in the airways. 4. Analgesics. Pain relief medications like acetaminophen or morphine help manage discomfort. 5. Antibiotics. If there's a risk of infection, antibiotics may be prescribed, such as ceftriaxone or vancomycin. 6. Nebulized medications. Solutions like ipratropium can be used in a nebulizer to help with breathing. These medications are selected based on the severity of the injury and the patient's specific needs. Always follow a healthcare professional's advice regarding treatment. People at an increased risk of developing inhalation injuries include 1. Firefighters. They work in environments filled with smoke and toxic fumes. 2. Construction workers. They may be exposed to harmful chemicals and dust. 3. People in industrial jobs. Workers in factories or plants that deal with chemicals are at risk. 4. Victims of house fires. Anyone caught in a fire can breathe in smoke and harmful gases. 5. People with respiratory conditions. Those with asthma or COPD might be more vulnerable. 6. Children and elderly. They can be more sensitive to smoke and chemicals. 7. Drug users. Inhaling certain substances can lead to injuries. Being in these situations increases the chances of breathing in harmful substances. Now you need to watch my video on sepsis or have a look at concussions.